For those of you who are maybe not familiar with Skills for Care, with a national strategic workforce plan and development body for social care in England. So we're supported by Gemma today, and I'm just going to hand over to colleagues to introduce themselves. So Jo, over to you.
Thanks, Julia. So I'm Jo Finnerty. I'm the Assistant Programme Director for Adult Social Care Workforce at NHS Greater Manchester, so working with the 10 local authorities. So I'll hand over to Carol.
Hi everyone, I'm Carol Mitchell. I'm the Senior Regional Transformation Lead for the North West at Social Care, and I've been working as a locality manager in Greater Manchester for the last 13 years, I think it is.
Thank you, Carol. So on the next slide, you'll see our lovely photographs and our session today. So we're going to run through, absolutely, we're going to run through the workforce strategy overview. So just have a look at how it was developed, where we are now, and then I'm going to hand over to Jo to talk about the Greater Manchester approach to strategic workforce planning and priorities, and we'll ensure we've got plenty of time for discussion. So we'll have a break in between the two presentations and also time at the end. Please introduce yourselves in the chat function if you wish. We want this to be as interactive as we can. We've got the slides, but we don't want that to be the only focus. We will be sharing the slides with yourselves as well. So there is links, there's a QR code to the information that we'll be talking about today if you want to go and have a further look at some of the supporting resources. And there's a couple of videos on the Workforce Strategy website as well. If you want to raise any questions, pop them in the chat. We can look at those as we go along. And as Gemma said, with the housekeeping, you pop your hand up if you want to come in and raise anything at that point, please do so. So to get the chat going, if people don't mind, we'd like you to just pop a number in the chat of how much you know about the workforce strategy, because we recognise we've got lots of people in the room for different roles. So 0 is I know absolutely nothing about it, and that's absolutely fine because then you're here to find out more. Or 5 is where, yeah, you know, I'm pretty familiar with it and I know roughly what's happening. So if you'd want to pop that in the chat, if you want to introduce yourselves as well at the same time, then please do so. But it'll also help just to pitch the session so you get the most from it and the strategy's relevance to your work and to your role. So Gemma, if you can just pop onto the next slide whilst people pop things in the chat, and I'll just wait for a few numbers to come in before I carry on. Thank you. Okay. Anyway, so we've got 3 1s and a 2 at the moment, so that's really helpful. So please keep popping them in the chat, and I'll start talking through the background to the strategy. So it was developed for the sector, by the sector. So it's a sector-led strategy in collaboration with health, adult social care and health sector partners and stakeholders. So I've mentioned it was launched in July 2024. So we're heading towards that 1 year on, and it's a 15-year strategy. So that sets out where we are now, the drivers and the case for change, and where we want to make changes to build the workforce of the future. So the development was led by Skills for Care to bring sector leaders and stakeholders together. And Skills for Care's role developed a steering group and also through 7 expert reference groups to facilitate the process and gather the information, the priorities for the social care workforce. Thank you. I'm just keeping an eye on the chat, seeing the numbers coming in. Thank you. So this resulted in an overarching strategy that is grouped into 3 themes, as you can see here. So that's attract and retain, train and transform, and they did follow the NHS plan. I appreciate them. The NHS plan is being refreshed. And the strategy includes a total of 56 recommendations and commitments that are driven by lead partners across the breadth of the sector. So that's from regulated professionals, or individual employers who employ personal assistants, care providers, and local and regional integrated systems. So the original steering group who developed the strategy have formed what's called the Oversight Executive Group, and that consists of key stakeholders from across health and social care. Many of them are responsible for delivering on or partnering on the recommendations and commitments. And the Oversight Executive Group, or the OEG as we call it, meets quarterly to support the implementation and to really drive the energy, momentum and the influence of the strategy. And you can see the QR code there on the slide, and that will take you to all the information about the strategy and the background to the development of that. So just moving on the slide then, Gemma, thanks. So since the strategy launched, it was due to launch, the date was the 11th of July and all ready to go when the government at the time announced the general election. So that we budgeted a week, so it was launched on the 18th of July last year. So obviously we have a new government with priorities, and we need to ensure that the strategy is talking to those policy priorities and really reflecting that language. So I'm sure most of you are familiar with the 3 health shifts. So looking there at sorry, just bear with me a second. Sorry about that. The hospital to community, analog to digital, and sickness to prevention. And we did a little bit of a mapping exercise around the recommendations and commitments and how they really speak to those 3 shifts. And members of the Oversight Executive Group, they regularly talk to DHSC officials, so to the Department of Health and Social Care, about the workforce strategy and how that supports the shifts. So it shows how the strategy is part of the solution to some of the challenges and priorities that are faced. We've also had the announcement of the Independent Commission into Adult Social Care. So that's going to be chaired by Baroness Casey, as you can see here on the slide. And the Oversight Executive Group members are coming together with a unified voice in their initial conversations with Baroness Casey, and really highlighting that a lot of this work is already been done. There's been a lot of time and energies on the priorities of the strategy implementation, and trying to avoid some of that risk of duplication of the work that's already been done. We've also published a paper that's on the website, the link's there at the bottom of the slide, to demonstrate how the recommendations do map across to the 3 shifts. And moving on to the next slide. So as we head towards 1 year since the strategy launch, so we've carried out a light touch review of the recommendations with partners. And broadly, the messages, the recommendations are the right ones. The review highlighted how the strategy does support the 3 shifts. And it also highlighted that it provides an opportunity to strengthen equity, equality, diversity, and inclusion, and include more the voice of people with lived experience in that co-production approach, which will be a key focus as we're heading into the coming months. And you can see here on the slide the latest data on progress. So as of the 1st of May, out of the 56 recommendations and commitments, 9 of them are complete, 50% are in progress, and 41% are yet to start. And you can see at the bottom there that the pie charts split out across the 3 areas that I mentioned at the start, across that attract and retain, train, and transform. And then on the next slide, you'll see in the top right box, so you'll see that the government are named as key levers for 49 of the strategy recommendations. So that really highlights the importance of an influencing role and the need to continue to advocate for the strategy. And from a cost perspective, when the strategy was developed, it's been developed as cost neutral as possible, with commitments and support from various sector partners. And then there are particular areas where it needs that government support and investment. And even at this point, the government aren't mandating the strategy. We are seeing that through Skills for Care and through other partners, DHSC funded work, such as the Local Government Association, the Social Directors of Social Services, that they are delivering support through their programmes that will map against and support the implementation of the recommendations of the strategy. So we've seen a change in picture since we last collected the data in December, and you can see the comparison pie charts there, and that the numbers are starting to creep. We see it more across attract and retain and train. So on the next slide, you can see where, with the yellow bits, you can see where it's moving forward with the recommendations starting to happen. The transform is a little bit more static. It does contain fewer recommendations than the other two areas, and that does have that longer term transformational focus, considering it we're looking at a long term 15-year strategy. So I appreciate that's quite a lot of information to absorb at this point on the that overview of the strategy. So if we, Gemma, are we able to just pop the slides down for a few minutes? If we just open up if there's any questions, reflections before I hand over to Jo. Thank you. Anybody wanted to raise, to ask?
No.
All good? Okay.
So I think you're handing over to me next, aren't you?
Oh, sorry, Carol. Yes, of course. Thank you. Thank you.
That's okay. So Gemma, if you don't mind, if we could have the slides back up, thank you. And next slide, thank you. Here we go. So as Juliet's mentioned, some of the recommendations and commitments have been completed and some are in progress. And we just wanted to give you a bit of a flavour of some of the things that have been, they're either in progress or being completed to date. So I'm just going to pick out a few of these to mention. So there is a lot in progress. But one of the things that was completed last autumn, you'll see the first circle there on the left, the public health and prevention e-learning. As part of the government's one of the 3 shifts from treatment to prevention, the adult social care workforce is very well placed to promote public health and well-being, to provide information and support to the people that they work with. So that e-learning module takes between around 1 and 2 hours. It's in 30-minute kind of chunks. It is rated really highly. It's available without having to register with the platform. It's on the e-learning for healthcare platform. And that is available free for anyone who wants to access that. So in your roles, it might be useful if you can promote that amongst your colleagues and amongst contacts as well. So the e-learning is available and has evaluated well from what we know. One of the recommendations in the workforce strategy, and there are some costing information in there as well, is around pay and what different pay rates within the sector might cost. And we know that pay in adult social care can be a factor to higher turnover of staff. So the government are leading, and you may have heard of a work in progress, the Fair Pay Agreement. There aren't many details about that yet, but hopefully what that will do when that comes into place is it will set a rate for social care workers that differentiates their role from what are classed as entry-level roles in other sectors, because actually adult social care is often described as low-skilled as well as low-paid, and we know that our workforce is anything but low-skilled. So that work is ongoing, and we're involved nationally in conversations around that as well. One of the things that happened very early on, and actually was launched on the same day as the strategy, is the statutory and mandatory training guide. This is something that is referred to often by care providers, by quality and contracts teams, and CQC were involved in the development of, well, really not the development, the updating of this guide. This replaced a previous version of a guide that we had. And what it does, it strips out, it sets out those the training and requirements that are statutory in legislation, those that are considered mandatory and good practice. And it really gives care services that opportunity to consider what they must deliver to their workforce, and also they can tailor additional training to suit their service. It's not overly prescriptive, so it did strip out some of the, it had got quite unwieldy previously, and that was launched last July. So again, that might be something to share with your contacts. And I'll just mention the care workforce pathway, which you may or may not have heard about. So when people talk about social care, it's often described as having, there's no career structure, there are no pathways to progression. And those of us who work in the sector know that's not the case, but there hasn't been a formally recognised way of people seeing what progression opportunities there are. So Skills for Care has worked with the Department for Health and Social Care probably over the last 2 years to develop this. And last April in 2024, the first phase of the care workforce pathway was launched. And basically what it does, it sets out the values required to work in care. It sets out the skills, knowledge, the kind of training that people would have in particular roles. And the first 4 roles were for those people joining the sector that were new to care, for more experienced care and support workers, for supervisors and leaders. So I would say that is more your senior care assistants and support workers, and also a role determined as practice leader. And for me, that could be a champion, you know, like I don't know, a diabetes champion, for example, within service. And then you've got the latest roles were launched a few weeks ago to add to the pathway, and they include the roles of enhanced care worker, which we know a lot of people working in care really do provide that enhanced level of specialist care around, for example, supporting people with dementia or at the end of their life. Or in Greater Manchester, you may or may not have heard of blended roles, where people are taking on additional skills and duties. There's also the role categories for deputy managers and registered managers within social care, and also personal assistants, who are the individuals employed by people in receipt of direct payments, personal health budgets, or self-funding their care, who employ individuals to support them. So definitely worth a look. And I'll mention in a moment actually as well some further work that's involved with the care workforce pathway. So I won't mention all the others, but they are just some indications of some of the work that is happening already. And if any of this is of interest to you and you want to have a further conversation about any aspects of this, do get in touch afterwards. So next slide, please. And we thought it might be useful. Now, in a moment, we're going to hear from Jo Finnerty, who I'm sure most of you will know. And GM have been very involved right from the outset about looking at the strategy and what's involved and mapping the GM strategy to the national strategy. But we thought it might also be useful to share some of the work that's happening in other regions as well, because GM are always leading the way in these things. And there are some other bits and pieces that might be of interest happening in other integrated care systems as well. So just to pick out a few, so in the Southwest, the Integrated Care Board have formally recognised the workforce strategy for adult care, and there's an implementation group which is now an ICB subgroup, and there are representatives on there from the integrated care system, from the regional NHS England regional team, local authorities, ADAS, and the Southwest Provider Chief Exec Network, and the care associations down there as well. So real cross-sector interest and support for that working group as well, which really shows a commitment to the progression really of the strategy at a partnership level. Also, Suffolk and North East Essex are working with partners. They're looking at, for example, wellbeing support for the adult social care workforce, and GM has a brilliant wellbeing offer as well that supports both health and social care colleagues. What was the other one I was going to mention? Oh yeah, North East ADAS and Cambridgeshire and Peterborough Integrated Care System are looking to extend and introduce the people promise, some elements of that to social care colleagues as well, which sounds like really interesting work. So just wanted to share that, you know, some of the different things that are happening across other areas really. Next slide, please. Do feel free to ask questions in the chat as well if you want to. I love this diagram. I love a bit of a visual with a road, and this is very much a journey. And it is a journey that different organisations at different levels can get involved. You know, it's not all the major strategic stuff. Some of it can be very practical, at not that strategic level really. So if you're interested and want to get involved, and there are some ways that ICBs are starting to look at this, but the recommendations are specifically focused on supporting integration and supporting systems with, for example, workforce planning, developing strategies that support your local system to become more integrated. And what we want you to do is make sure that you're using things like, for example, the social care workforce data that Skills for Care collect. And Jo, I know you use our data all the time, and that's used quite significantly in GM. But also making sure that we have a one workforce approach, that there's equal partnership across health and social care, that providers are involved, social care reps. Quite often, not so much in GM, but quite often Skills for Care or other sector representatives are the social care rep, and actually you need provider voice in this as well, really. And there are some really easy things that I think could be done and have been talked about extensively around things like having joint training, joint placements, joint, secondments, looking at ways that we can work together to bring the two parts of our very integral sectors together, really. We're recommending in other areas that don't already have one that social care academies are established, and we know that that work is expanding across England, but GM have a social care academy, which is great stuff. There are things like shared technological approaches, and also in some areas focusing on aligning terms and conditions, which we know has been a barrier between our two sectors since whenever, really. So we are in the process of producing a guide to help integrated care systems and colleagues. So that will be along shortly, and so keep a lookout for that. And I think, Gemma, if you wouldn't mind taking the slides down again, we've now got an opportunity for any questions, reflections, any thoughts, really. So there's a question from Beth.
Yeah,
is mental health involved in this strategy? Sporting Mind is a charity who wants to transform the nation's mental health with sport and physical activity. The strategy, Juliet, covers all of adult social care, doesn't it? All of the settings, disciplines, and roles, and so mental health will very much be a part of that.
It does. I was just about to hit return on a comment back to you, Beth. There's a really strong focus on well-being and prevention, definitely, which fits across with, as you're saying, with sport and physical activity for sure.
And I think just to chip in as well from a GM perspective, I'll talk through in a minute, what some of the areas are that we're working on, but absolutely always open. And we've got from a GM program perspective, obviously we're the, or I'll be talking about the workforce element of the adult social care transformation program, but we cut across with the mental health program as well. So we've got individuals in our team that then sort of cut across into the wider mental health program. So I'm sure it's worth a conversation, Beth. Obviously outside of this meeting, but to look at where we can link that in.
Yeah. And Juliet, I was very remiss in that I didn't mention our workforce strategy champions, so apologies about that. We have been asking for people to volunteer and step up as workforce strategy champions, and that might be something, Beth, that is something you might want to get involved in the future. So we are still developing what this looks like, but what we hope is that champions will articulate the strategy and share the strategy and the recommendations and the progress and developments, particularly within their networks, and we'd love to hear from people who might want to be involved going forwards to be involved in that. And I think, have we got a link for that as well about how to sign up to that? Juliet, do you want to add anything on that?
I'm a little bit conscious of time, so I'm gonna bring Jo in, and with time at the end, we'll talk about the champions, but I'll pop something in the chat as we're going along. Fabulous.
Yeah. Thank you. So Gemma, if you could put the slides up.
Thanks Carol, and thanks Gemma. We'll put the slides back up and then move on to the next one. There you go. Okay, that's really wordy, so don't worry, I'm not going to literally read it out loud. But it was really just to set a bit of context, I suppose, from a Greater Manchester perspective about our involvement, I guess. So we were certainly involved in the development of the strategy. Various individuals across social care in Greater Manchester were part of those groups that Juliet talked about before. And I guess when we look at our strategy, it did predate the national strategy, but because we knew it was in development, we did a sort of educated guess that it would follow broadly the NHS workforce plan, which obviously, as Juliet said, it does. So it aligned really well. So luckily we've got everything organised in the right way. So the development of the strategy, I suppose, came about through really wide engagement with stakeholders in GM across social care, but also health, so secondary and primary care, and then wider stakeholders, so including Skills for Care, but also VCA, SFE sector, and others much more widely, combined authority and so on. So as I say, I won't read it, but what that slide hopefully does is sets out our overall mission in Greater Manchester for our social care workforce. So essentially being the cornerstone of delivering high quality, compassionate person-centred care, and how we'll do that through collaboration, sharing good practice, embracing integrated working, which I'll talk a little bit more about shortly, and where we can maximise those investments and to deliver that across GM at pace and at scale. So we do recognise that each locality is different. They'll have different priorities, broadly the same, but there will be differences, different approaches to workforce. So some do have their own academy approaches, but what we need to focus on from a GM programme perspective is what can we best achieve at a Greater Manchester level. So through working together with those locality workforce leads, how can we, and obviously providers, how can we shape what that looks like for Greater Manchester? Could you move on to the next slide, Gemma? Thank you. I won't labour on this. It was more as a sort of scene setter, really, particularly for those of you on the call that don't work directly in social care or aren't as familiar maybe with the way we're set up in Greater Manchester. So, and just to give an idea of the scale and scope, really, I suppose, of what we're talking about for Greater Manchester. So, 82,000 posts with a vacancy rate of just over 7%. So still high vacancy, still pretty consistent with the national picture. But what we have seen, certainly with these figures, which are Skills for Care, should have said that, should have credited you with this. This is Skills for Care's data. What we saw, I think, with this latest data set from Skills for Care was that increasing dependence over the last couple of years on international recruitment as well, which is interesting given the announcements recently. So that's something we need to sort of factor in our planning, our workforce planning. Other information on there around pay rates, as we said before, it's not a low skill sector, but it is a relatively low paid sector. What is a positive, I think, in Greater Manchester, you'll be aware of the Mayor's Good Employment Charter and Real Living Wage campaign, and there are increasing numbers of employees across social care now in receipt of a Real Living Wage, and that continues to go up through the work that the combined authority and ourselves do with local authorities. So that's a really positive picture. So do you want to move on to the next one, Gemma? I'll talk a bit more about our plan now. I suppose what this slide tries to show you is that we certainly don't work in isolation in terms of that planning. So up there on the top row is the workforce strategy for adult social care in England. So clearly that's a big steer for us in terms of where those priorities are. But what we also need to balance that against is what are our other GM-wide local priorities, so things like the Live Well programme, the GM sustainability plan, the people and culture strategy for health and social care across GM. So we need to make sure that what we develop weaves in all of those various aspects, and there is a lot of alignment obviously between those now. So we need to make sure we're aligned to national priorities. So things like the international recruitment programme through the DHSC, we've been a really keen partner in that work, and skills transformation, which is obviously happening, as we speak as part of the wider work. So we need to make sure we're absolutely plugged into that to make sure we get the best really for Greater Manchester through that. And as I said, local priorities, are integral to this. So we need to look at what are the priorities at a local level. So what are our 10 GM local authorities and providers across those localities saying are their priorities, and how can we at a GM level support that? If you move on to the next one, Gemma. Thanks. So what what we start to describe here now are what those high level outcomes are for 25-26. I should say, we're still in the sort of final stages of really sort of pinning it all down, but we are working on it clearly at the moment. So we know some of them will absolutely be priorities. Some of the finer detail is still to be determined. But as I mentioned, we've looked at that under those three pillars of the national strategy. So attract and retain, train and transform. So attract and retain around creating, retaining that sustainable, flexible, integrated workforce across GM, so we can be responsive to those increasing complexity of needs, of support that people need, and to support the sustainability. That's the word I can't say, Carol, of the market. And also that includes international recruitment as part of that. In terms of train, how can we look at innovative, locally led learning opportunities? So what is that we can put together that will complement some of those existing offers, and how does that link into the career pathways from pre-entry level right through to post registration? And then transform. So what can we do differently through the power of 10 localities that we can pull together as a single plan? And then on to the next one, which I think is my last slide. Yes, so lots of detail in here, and I certainly won't go through all of this. But what I will do is pick out some of the highlights, I suppose. As I say, this is still to be finalised, so a lot of these are already in train, but some of them, what we've done is gone out. We have a Greater Manchester Adult Social Care workforce delivery group that meets bi-monthly. So all of this has been designed with that group. So that's locality leads, provider leads from across Greater Manchester. And essentially what we do is liaise with that group, look at what their priorities are, where can we support that at a GM level, and we pull together that plan. It's a big plan when you look at what's on it. As I say, I won't go into the detail, there's a hell of a lot on there. So what we need to do is now say, okay, of those priorities, what are our top priorities? And that's where we're at the moment. So what do we want to put most of our focus on for the next 12 months? So that's back out with the sector now to identify what we should be, what priorities we should prioritise. So the key ones I'll probably pick out just briefly. Development of the academy. So that was mentioned earlier. We've had it was an ambition for Greater Manchester to set a social care academy some time ago, and it's now been in existence. I think it's about 18 months, developing as we sort of go. And I think it's probably a good example of where we can do things once at a GM level that support local offers aligned to that overarching strategy. So that will include leading. So through the academy, we'll lead on the GM work relating to career pathways, looking at innovative ways that social care can access training, because again, historically, it's been very difficult to roll out training. We quite often, we don't get great take up. Sometimes if it's off the shelf, it might not be particularly social care focused. So we've tried to do some work this last sort of 12-18 months around that, and looking at ways in which it can be made more accessible. So app-based training is something that has just rolled out, and anybody interested in that's on Falls and Frailty, get in touch either through the chat or afterwards, because we can certainly, as much promotion of that as possible. So that's been developed in collaboration with the University of Greater Manchester, what was Bolton. So they've done some brilliant work on that. And things like development of coaching and mentoring opportunities across Greater Manchester. So that's something that people were keen to see, and how can that support upskilling, development, and so on of the workforce. So last year, using a more, I suppose, flexible approach, using funding we got around CPD and wider workforce training, we saw it was over 2,000 clinically registered and wider adult social care workforce individuals joining training offers offered through that, and a vast range of topics that I couldn't possibly remember off the top of my head now, but covering all aspects of social care and clinical offers as well. I think another one that I'd pick off there as well is the workforce modelling tool. So again, linking into what we said earlier around data and intelligence. So actually, to make sure we're focusing on the right things, we need to know what the sector needs. As Carol said, there is some brilliant data available through Skills for Care. We need to, I think, get better at encouraging providers to contribute to that data, so that we've got a much more robust, I suppose, offer and intelligence through that. So that what that modelling tool will enable is providers and commissioners to better be able to workforce plan. So at the moment we're looking at, well, what data do we need in there? Is that all already in there, or is this a separate sort of piece of work we need to do? So again, those of you that work in the sector will see that coming out shortly, and that's across local authorities and the independent sector. And the last one I'll pick out, because I always do, is blended roles. We could do a whole other session on this alone, I think, and some of you may have heard about it previously, but what we want to do over the next 12 months and beyond is build on the brilliant work that's happening across localities to develop integrated neighbourhood roles that deliver great outcomes for individuals, more joined up care and support. As Steph, the DAS at Tameside, always calls it, less knocks at the door for individuals. So it's far more joined up and integrated at a neighbourhood level. But what it also does is encourage development and upskilling for the social care workforce, linked to the enhanced care worker on the new pathway, so we can see how the work that's happening now starts to embed itself, I suppose, in that new strategy and be supported by the strategy that Julia and Carol have described, to really raise aspiration and encourage people to progress their careers in social care and see what a great career it is. So the programmes to date around blended roles, and there's a number of localities now rolling out programmes. They've seen real improvements around insulin management through insulin administration by care at home and residential and nursing homes, the care workers in those environments, pressure area care, and also falls and frailty. So loads more to come around that, in terms of upscaling it much more widely across GM, but also incorporating new and different roles using that same approach and methodology. So we really are starting to see some improvements, as I say, most importantly for individuals, but also from a workforce perspective across GM. So I'll shut up there because I've rattled through probably enough of that. There's loads, I could do ages on it, but what I would say is, if anybody on the call thinks they can contribute in any way, or like Beth said before, there's actually a piece of work you're doing that maybe links up to our strategy and delivery plan for this year, then please get in touch. And I will hand back over to Juliet.
Thank you, Jo. We're coming to the end of our time. Gemma, if you can just flick over onto the last slide, because we've got contact details on there, and people will be receiving these that you can see there. So you've got information there about signing up as a strategy champion as well. I've popped a little bit of information in the chat there, and our email address goes to the implementation unit. So please get in contact. You can see there's Carol's information, and also Jo, if anybody wanted to follow up on any of our conversations today. So I appreciate that we've come to the end. If people do have a burning question, please raise that, or we'll